Thank you very much. Very generous. I thought we would talk a little bit about the liver since we spend so much time talking about the lung, so it's great to have the panel. My comments are actually going to be, I think, probably briefer than 20 minutes. But a lot of times people talk about the liver, but they don't really understand the liver. I think we all sort of intuitively understand the lung. It blows air in and out. But the liver, people say, oh yes, the liver, and nod their heads. But I think it's worthwhile to understand what the liver does. The liver does many, many jobs for you. This is my not very good attempt at art. The liver does many, many jobs. So the liver is attached to the intestine by a little tube called the bile duct. And down that tube comes a liquid. And that liquid helps you digest food, especially fat. The liver also cleans waste products from your blood and dumps some of those wastes into the bile that comes down that tube, which is then eliminated through the intestines. The liver also makes many things. The liver makes alpha antitrypsin, but the liver makes many, many other things and then dumps them into the bloodstream. So there are many things in the bloodstream that come from the liver. And the liver also processes many nutrients and protects you from many toxins. It also processes many medicines. So the food you eat has dangerous chemicals in it, and the liver removes those chemicals or modifies them so that the rest of your body isn't exposed to it. So the liver's doing many, many different jobs. And sometimes when the liver gets sick, one of those jobs starts to go downhill and goes badly, but the others remain functioning normally. So really, to understand how the liver's working, it's more than just one blood test or one x-ray. A wide range of evaluation is really needed to understand what the liver is doing. This just summarizes some of the functions of the liver and then the malfunction. So if the liver's not producing bile, weight loss, diarrhea can occur. If the liver's not removing the waste products it's supposed to remove, you can turn yellow. That's yellow jaundice. Also, in severe cases, people become confused because so many toxins build up in their system and their brain doesn't function normally. If you're not processing nutrients normally, you can lose weight, become low in certain vitamins. The same if your liver's not protecting you from toxins. And if your liver's not making things, the blood can become unbalanced. People can accumulate extra fluid. They can develop swelling, and many other body functions can start to become abnormal if the liver's not making part of the blood that it's supposed to make. So there are many, many potential symptoms. And in fact, many of the symptoms overlap symptoms that can come from lung disease. Things like fatigue. Many lung patients feel tired. Many liver patients feel tired. And so sometimes, people get confused about where a symptom might be coming from. Another thing that's commonly misunderstood is what's called fibrosis or cirrhosis of the liver. Again, this is a term that many people have heard, but let me just cover what it means. So fibrosis is scar tissue, and cirrhosis means a very large buildup of scar tissue in the liver. So just like if you cut your skin and a small scar might appear as it heals, if you cut your skin repeatedly in the same spot, a large scar might appear. So that can happen in the liver. If the liver is repeatedly damaged, either from having a disease like alpha antitrypsin deficiency or an infection in the liver like hepatitis C or consuming too much alcohol or other damage to the liver, over time scar tissue can develop. Now, all the blood from the intestine goes to the liver on its way to the heart. And that's so that all the nutrients or toxins or whatever in the food you eat goes to the liver for processing before it goes anywhere else in your body. So all this blood is going from the intestine to the liver to the heart. And so if the liver develops a lot of scar tissue, the blood has trouble getting through the liver. It's like a drain that's partly clogged and running very slowly. So if your kitchen drain is running slowly and you run the water may start to back up in the sink. And that same thing can happen in your body. If there's fibrosis or cirrhosis of the liver, the blood cannot get through and starts to back up into the rest of the abdomen. The blood can actually start to flow backwards, and then the spleen, which is on the other side of your abdomen from the liver, can become enlarged, and other blood vessels in the intestine or the stomach can become enlarged. And in severe cases, those blood vessels can rupture and people can have serious life-threatening bleeding inside their intestine or inside their body. That bleeding and the blood vessels, when they become large, that's called portal hypertension. The name isn't all that important, but I think what you have to realize is that fibrosis or the cirrhosis of the liver can come from many, many things. And it's somewhat separate from the other functions of the liver I talked about. Sometimes people can have cirrhosis of the liver, but all the other functions are functioning normally. And I have seen a number of alpha-1 antitrypsin patients like that who have cirrhosis of the liver and have portal hypertension and are at risk for serious bleeding, but all their function liver blood tests are completely normal. So again, it takes many, many kinds of analysis to understand how the liver is doing, whether it's healthy or sick, and what to do about it. So I'll just briefly cover that even though for alpha antitrypsin, at the moment we don't have one medicine that treats alpha antitrypsin deficiency in the liver, but we do have many treatments for liver problems. If people become low in certain vitamins, we give them extra vitamins. If their blood is low in certain proteins, we can give that back. If there's bleeding in the intestine, we have ways to treat that. So there are treatments for liver disease, but we just don't have the cure for alpha antitrypsin. Let me just mention some common liver tests that people get when they go to the doctor. Again, these are, I think, tests, or LFTs. Other people call them AST and ALT, all these different letters. But really, again, these are chemicals found inside liver cells, and blood levels should usually be low. If liver cells are damaged, the chemicals leak out faster, blood levels go up. So measuring these chemicals in the blood is somewhat of a measure of damage to liver cells or swelling in the liver. They don't actually measure any function of the liver. In the United States, they're commonly referred to by some doctors as liver function tests, even though they don't measure any function of the liver. So it leads to a lot of confusion among physicians and patients. The GGT is similar. The GGT is a chemical that looks at the health of that little tube, also what's called the alkaline phosphatase, the bile duct. You can look at the health of the bile duct somewhat by looking at that blood test. A blood albumin, that's a protein made in the liver, dumped into the blood, much like alpha antitrypsin. Measuring it in the blood helps you understand that the liver is making what it's supposed to make. The liver is also involved in blood clotting. So tests of blood clotting are commonly performed to see if the liver is doing that job. And again, people with severe liver problems can sometimes bleed very seriously if their blood clotting is not normal. We also, liver doctors, just like lung doctors like to take a chest x-ray or get a CT scan, liver doctors like to make a picture of the liver. And there are many ways to do that. A CT scan or MR of the liver, although an ultrasound of the liver is increasingly very, very useful. It's like what a pregnant lady has. It doesn't hurt, it's not dangerous, it's not very expensive, but it's a very, very good way to get more information about the liver. And finally, some people get what's called a liver biopsy. That's where a needle is inserted into the liver and a sample is removed about the size of a toothpick. It's about 1/10,000th of the liver, so you don't really miss it and it grows back. But it gives the doctor a chance to analyze under the microscope the liver directly, and that helps understand how much fibrosis or cirrhosis might be in the liver. It's very difficult to measure that without the biopsy. We do have some new technologies that are coming along that hopefully in the future will make the biopsy not necessary, but right now, some patients still require a biopsy. Let me just make a few comments about how alpha antitrypsin works in the liver, and then we can get to our panel. I'm afraid I'm going to say something wrong, and they're going to want to correct me. One of the interesting concepts about alpha antitrypsin deficiency is that the disease, as I think many of you might have heard before, comes from the abnormal shape of the protein. The normal alpha antitrypsin folds up very quickly in the liver, just like you would take a sheet of paper and make a paper airplane out of it. If you just take a piece of paper and try to throw it across the room, it doesn't go very far. But if you fold it into a paper airplane, it'll go very, very far. So the shape of the protein has a lot to do with the job it's going to do. The Z-alpha antitrypsin protein doesn't fold up into the right shape, and that's what causes the disease. And this is just a cartoon that tries to show that. So on the left-hand side is a part of the liver cell called the ER, and the little white wavy lines are newly made pieces of alpha antitrypsin protein. And in the normal situation, they fold up into the little knot. And when they make the little knot, the liver recognizes that as normal and releases it into the blood. And that's the little green knots. A few of them can't fold up right, and they get thrown in the recycle bin, and that's the red at the bottom. However, in the example of Z-alpha antitrypsin, you have the liver still making the white wavy lines, the new alpha-1 proteins, but they can't fold up into the knot. Very few of them can fold up. Maybe only 15% of what's made in the liver is able to fold up and released into the blood. Most of the rest get thrown into the recycle bin. Although for reasons we're not sure, some of the proteins don't make it to the recycle bin. Some of them build up inside the liver, and that's what damages the liver. I don't know why that's not showing up. Maybe it'll give me a second. This is your liver under the microscope. And what it shows is the buildup of the Z-alpha antitrypsin in the liver. I guess it's not going to show the other one. The arrows, it's hard to see on the left-hand side. Let me go back. Well, we moved on. So how does alpha-1 cause damage? Well, in the liver, it's the Z protein builds up inside the liver, so the liver has too much. The lung disease is because not enough is in the blood. That's why it's called alpha antitrypsin deficiency. Deficiency means not enough, and the blood does not have enough, but the liver has too much. So the treatments have to be different for the lung and the liver, unless we could somehow figure out how to get what's in the liver out into the lung, which would be a great idea. As you know, alpha antitrypsin is highly variable, and it's still something we're struggling to understand. The risk of life-threatening liver disease in children, so that's either death or needing a liver transplant, may be as low as 5%, but over a lifetime, the risk of liver damage may be as high as 50%, and it may increase as people get older. This is data from Malmo, Sweden, that was put together by Sten Eriksson, one of the discoverers of alpha antitrypsin deficiency, and he collected the records of patients who had passed away from alpha antitrypsin deficiency between 1962 and 1997. And the bar on the left-hand side is smokers, and they tended to die at a mean age of 56, and the dark bar is the number of smokers that had emphysema, so most died with emphysema. The right-hand bar is people who never smoked. They tended to pass away at age 73. And the light bar that takes up most of that bar is cirrhosis. So many of the people who smoked had emphysema. Many of the people who did not smoke lived longer but developed cirrhosis of the liver. So there seems to be a risk of living longer and developing liver disease. I think sometimes people talk about being lung affected or liver affected. I'm not sure that's a good way to think about it. I think everyone with alpha-1 is susceptible to lung disease and susceptible to liver disease. It's just that they tend to happen at different ages. There's this group of small children that develop liver problems, but generally not lung problems. In middle age, people, especially if they're smokers, tend to develop lung disease, but the liver disease in adults doesn't usually happen until a little bit later in life. So it's really these things are happening at different ages. They may happen to the same person. I think I'll just skip ahead and so we can get to the panel. I think Often, and this goes both ways, a patient is seen by a liver doctor, but then they may have liver problems, but they're never seen by a lung doctor. And vice versa, they may be seen by a lung doctor, but not many liver tests are done. And I think what we need to do is be sure that as a community, we're looking to the lung and the liver and being sure that we're healthy everywhere. Let me just cover some common questions quickly. People often ask about alcohol consumption. We don't have a definite answer to that. I'll tell you right off the top. We know that high alcohol consumption can hurt your liver. On the other hand, there's probably, if your liver's healthy, there's probably a safe level of alcohol consumption, although we don't know what that is for alpha-1. We're trying to find that out. But if we look at other liver diseases in adults, for example, hepatitis C, which is a common infection of the liver, for which there's been a lot of research. And if people have hepatitis C, but their liver is healthy, then some studies show that 3 drinks a week are safe. Although if people have significant liver damage, then no drinks would be better. Also, avoid obesity. If you get fat, your liver gets fat. And just like being overweight is a stress on the heart and the lungs, being overweight is a stress on the liver. So avoiding being overweight is important. People often ask about medications. Tylenol, or paracetamol, as it's sometimes called in Europe, in overdose can hurt the liver. Although in normal doses, it's actually very, very safe. In some of the studies in animals, we find that actually what we call non-steroidal anti-inflammatory drugs, so that's aspirin or ibuprofen, may be toxic to the alpha-1 liver in an animal study. We've never tested that in a person. I think what I'll just wrap up since we need more time. I think what's important is that there's a lot of liver research being done, and I think we're getting close to being able to do a lot more for alpha-1 liver disease. We have, for example, a mouse that gets the alpha-1 liver disease. And so we study this mouse very carefully to understand how the liver gets hurt, and then we can test medications in the mouse that we may be able to develop into treatments for people. Well, it turns out we can cure the alpha-1 mouse with about 10 different medicines. But now our challenge is, as the previous speakers had said, is taking these medicines from a medicine you can give a mouse to a medicine that's acceptable for a person, that is effective but has low side effects. I think I'll stop there, except to say that we do have a lot of research going on, and I think hopefully in the future we'll be able to offer many different treatments to patients with liver disease, although we've got a lot of research and a lot of work to do before we get there. So take care of your liver. You can't live without it. Thank you.